Welcome to the ANEW Insight Podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogram Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. I follow my guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Welcome back, everyone, to the ANEW Insight Podcast. We're back for the second half of this amazing interview with trauma psychologist and multi-channel eye movement integration, or MEMI expert, Dr. Maria Gear Haugen, or Dr. H, as she's often called. Dr. H gave us some invaluable insight into her extensive background and how MEMI can be a path forward out of trauma into healing. I'm so excited to learn more. Dr. H, welcome back.
Thank you.
Yay. Okay, Dr. H, I really want to know what drew you to MEMI. What made it, the pivotal moment for you in trauma treatment with your clients?
Well, I had been doing trauma work for many years, primarily at the VA, and used really the traditional approaches that we use for trauma: cognitive processing therapy, CBT, different kinds of exposure therapies. And while certainly some people had success with them, over time I was finding that it wasn't durable, so a lot of people would come back, things happen in their life and symptoms arose again, uh, and then it wasn't as effective for everyone. In addition to the fact that I know a lot of people, I've had examples of people coming to the parking lot of the clinic and turning around and not coming because it's so frightening. It is a frightening thought to be facing some of your most horrific experiences in your life. And so that not reaching people really I started to think there's got to be other approaches. And so I started investigating and I looked into a number. I actually got training in several of them, but they still didn't seem to me to be as effective as I was hoping to find. And I came across MEMI, and I read the book. There's a book written in 2021. So this was a pretty new therapy. And I read the book and I did the training right away and I started using it right away. And I was just astounded how quickly, how profoundly people changed. Um, I I ethically always offer people every option that I'm trained in for anyone I'm working with, but I did find that plenty of people wanted to try something new, and it's just really a game changer.
Oh,
And
that's
and
amazing.
yeah, yeah.
So 2021, you found the book, and the book is entitled what?
It is called Multichannel Eye Movement Integration. Never too far from my side.
And who
Uh,
wrote this? And then how did you find the training for this?
so it was written by a guy named Dr. Mike Denninger. He's out in Tucson. And he actually he has a really interesting background. And as a mental health provider, he trained with a hypnosis expert. He was involved in linguistic programming, or NLP, back in the day, and he started to integrate a lot of those practices. NLP, unfortunately, wasn't very well documented, and so it's not very well known these days. But he integrated what he knew about EMDR, eye movement, EMI, actually, um, techniques, and integrated this over a period of time and wrote it up in a book at one of the urgings of a client who was very enthusiastic about it. And so I quickly read it. I did the training. If you go to eyemovementintegration.com, which is where I went, there is training available on there through a webinar. It's about a 12-hour webinar. You can do it at your leisure, and that's what I did. Because at that point, the only trainers were in other parts of the world. This is new to the United States, and I'm proud to be the first psychologist offering training in it. But that's how I did my training, and then there's hours of consultation that are necessary that I did with Mike to get me started.
Oh, wonderful. So let me get a picture of the types of trauma or presenting problems that you feel respond best to MEMI compared to other therapies.
You know, I don't think there's a difference in terms of the type of trauma. The people that I've traditionally worked with tend to be people with um, chronic, complex trauma histories. So maybe a lot of childhood trauma, adulthood trauma, physical, combat, sexual abuse, neglect. And I really haven't found a difference with MEMI in terms of what I can work on. The difference that I do see with MEMI is that it opens the door to work on small t trauma. You know, we've all had events in our life that are heartbreaking and disruptive and harming to us, but may not necessarily reach the threshold of PTSD. And so people may be, getting treatment for depression or anxiety or just, not being able to function well in relationships. And so with MEMI, rather than focusing on a diagnosis, we focus on what we call a problem state. And that problem state can be virtually anything. And I really view that as opening the door to being able to help a lot more people because not everyone who has traumatic events in their life or even adversity has PTSD. And I find it helpful to be able to do that, to offer MEMI for those people.
Absolutely. I'm also curious about how validated research might support this. Are there studies that you can point us to or tell us about that help to support MEMI's effectiveness?
Well, this is new. And so in the book, there are some studies that have been done. They're right in the book. Mike's actually working on a second edition, which he's going to add a lot more. I'm in the process actually of collecting data from people that I've worked with, people that I'm training, work with, even people in other parts of the world, because I want to write these up as case studies and start to get the word out. Um, and so I'm encouraging people to get trained in it so that we can do more of those in-depth comparative studies and help put this forward and get this help out to people.
Oh, absolutely, and I think that
Yeah.
that would be the next logical step. I'm
Hmm.
sure that because of, its growing popularity and people becoming trained in this, that there are a lot of, transformational stories that you've
Hmm.
heard of and that you've witnessed yourself. Can you share, of course, client details, changed for their, confidentiality. Can you share a few examples of these transformations that you've witnessed in clients through MEMI who have worked with you.
One of the amazing things, speaking of confidentiality, is that when I was working with people before I presented at the APA, I told them about it once it was accepted. I think that was back in February. And I had so many people say to me, use me, it's okay. I totally waive everything. I'm so enthusiastic about it. A couple of people even said, I want to go. I want to be there as your testimony. So
Wow.
it's amazing that they're excited about it as well as me being excited about it. But sure, um, I'll talk about a couple people because I think they're in some ways good examples of folks who need our help to move forward in their lives. The first is someone who had experienced combat trauma. He was in his mid 30s, had become very ineffective in his life. He had stopped working. The relationship he was in had broken up. He was feeling hopeless, he had dropped out of school, He was living with his parents, really hesitant to get trauma treatment, but finally, as he said, I have nowhere else to go, he accepted a referral to our clinic. And so he's one of those people who I think is common. You get in a relationship with your provider and you don't want to go out to another provider to get help. But because most trauma treatments require a lot of intensive training, generalists really normally aren't certified to provide that training, which is a benefit of MEMI, by the way.
Mm.
But anyway, I worked with him. He was someone who was very perseverative in his thoughts about what he went through in Afghanistan.
Mm.
He was in a desperate situation in a part of Afghanistan that had not been supported, and so he was literally living in a ditch that he and his squad had dug for 9 months without support, and so that experience, as well as the fighting that was a part of that, really stayed with him, and
Wow.
he was having trouble freeing his mind up from that.
Mm.
And then he had a second trauma. He had his older brother, died by suicide while he was over in Afghanistan, and that really haunted him.
Awful.
And, so we worked on the first trauma. His primary goal initially was the combat trauma, and we worked on that. Um, we always we do an assessment at the beginning of trauma therapy in terms of their symptom burden and at the beginning and at the end. And for him, his symptom burden was pretty high in the 60s. The highest is 80. And so high 60s is really up there. And we did one session on the combat trauma, and that was it. His score went down to a 3.
What?
Yeah,
Can you
3.
describe what that session was like?
It was intense. He didn't describe, and it wasn't until after that I really knew the details. He elected not to tell me any of the details before he started, so I didn't know. Um, he was very engaged, he was very willing, he was open, and it changed his brain. I mean, this is really based on the science and what we know about the brain and how it's changed from trauma. And disrupting those patterns changes the amygdala so that it calms it down, and that, of course, is what's responsible for a lot of those symptoms. But it blew his mind, his expression. And
Wow,
then
blows my
the
mind.
yeah, and then he elected to work on his brother's death. He hadn't planned on doing that, but it had been really haunting him, and he decided to do it, and so we had a second session on that, and that was as much as was needed.
That is amazing.
One of the things I really like and is very different about MEMI is that, to start out with, we always ask people if they're willing to change. Are you willing to fully accept and change anything, change these things and the way that this event has impacted your life? And, that's an affirmative a buy-in that we want from them at the beginning. And then at the end, one of the criteria to know if we're completed is, are you satisfied with what we did today? I don't know of another therapy that does that. I think it's a little scary to ask because we're
Mm.
afraid of the answer, but are you satisfied with this? And do you feel like you can manage this now? And so to me, those are really important and very direct ways to measure, are we done? And so we get to that point when their score 0 to 4 go down on all sensory aspects of the event, and they feel like they can manage it, and they really feel like, yeah, it's not bothering me anymore. And I think those are really significant elements of MEMI that are empowering to people.
Absolutely.
Yeah.
From a therapist's side, I'm curious how you feel. Normally, we set up a relationship and have a longer term, course of treatment with clients.
Mhm.
And that to me is something that's so incredibly rewarding is,
Mhm.
to have that relationship and to see the arc of, what we're doing together and then have the symptoms resolve and, eventual termination. I often have clients who just kind of continue and they use
Yes.
it as self-care.
Mhm.
Are your clients coming to you just for 1 to 2 sessions and then done? Do they wish to continue just to have therapy and to have, a therapeutic presence in their lives? How does that work in your practice?
Well, when you think about symptoms of PTSD, obviously there are a set of criteria um, that are part of that pattern of symptoms. With something like trauma, the impact on people's lives is much more pervasive in parts that really have nothing to do with the diagnosis. And so often people find that they want to make sure that they feel like they can go out again, for example, but they're still a little apprehensive about meeting new people, maybe if they want a relationship and so it becomes kind of practical. How do you support all of those other parts of their life that have kind of fallen apart because of the impacts of this trauma in their life? It's rebuilding all of those things around it to really have them get back to living a full life. And so I think that's a kind of a natural thing. The
Mhm.
trauma itself is changed in the brain, but that doesn't mean all of the parts of your life that have fallen away because of the trauma and the symptoms are automatically back. You don't become
Mm.
sociable just because you want to or you don't feel afraid of it anymore. And so, that's really, a lot of coaching, a lot of insight building, understanding about themselves and their relationship, rebuilding an identity in some cases. And so there is that. But to have someone move functionally from I'm afraid to go out of my house, in some cases I'm afraid to go out of my closet, to oh, I can go shopping. I can go attend a concert. I can talk to my friends or go to a family get together. That's the huge jump that people make with MEMI. And then I find a lot of support in addition to that is helpful.
Oh, wonderful. So for
Yeah.
you, your client might come to you. Originally, you do the MEMI session or sessions with them, and then they usually try to stay with you in order to improve the functioning of their lives until they feel like that those surrounding problems are more resolved as well.
It can also be that someone comes not even knowing the impacts of trauma. They may be depressed. They may be so anxious that they can't function very well at work or in a relationship or with their kid's school. And so, you may start out with a depression focus or an anxiety focus or even a confidence focus. And then at some point, it's like, oh, do you think my parents' divorce that I never really processed could be impacting me? Right?
Mhm.
And so those events can kind of emerge in therapy, at which case you can do MEMI to really help them build some confidence and shed some of those reactions that they didn't even know they were carrying around.
Oh, I think that that's just brilliant.
Mhm.
So, give me a picture of your trainings with other therapists. How have they responded when you've trained them in MEMI? And what are
Well,
their experiences with their clients?
I revert to this first person I'm working with. She actually did attend the APA conference, and she told me afterwards, since we've been meeting, she said, I walked out of there and I thought, this could be a game changer for my practice if what she's saying is true. And so like me, she read the book and she did the training and now she's in consultation and she keeps telling me, I met with her just earlier this week, uh, telling me about some poignant realizations that people have when they've completed MEMI. their change in perspective. We don't focus on the thoughts, but the thoughts change because there's an organic change in the brain, and that's what she was referring to. It's very powerful. As I said, she's someone who's been doing EMDR for, think, since the beginning. And so, for her to find it be as powerful as it is really encouraging. Yeah.
Yes, it maybe does point to, the more linear aspect of EMDR and how MEMI uses the entire visual field, and maybe
Mhm.
that might be the missing piece in
Mhm.
EMDR, because EMDR can be very effective, but
Yeah.
might not be for some people, and maybe
Right.
that's the missing piece. That
Yeah.
probably is what future research, if you can
Exactly.
compare and contrast the
Yes.
effectiveness of both, that would be really powerful stuff.
Yeah.
Because, I mean, there is some validated research with
Oh,
EMDR.
absolutely. Absolutely.
So, yeah, I would love this. And so what do you see as the future for MEMI? Do you think it will be as widely recognized as EMDR? If so, what needs to happen for that to occur?
Well, I really think this could be bigger than EMDR because of the things that I've already talked about. It just makes trauma treatment so much more accessible by, in so many ways. It's quicker. We haven't even talked about the ways in which we really ensure safety. And I think for anyone who's been through trauma, safety is a big deal, as is control. And so we really have parts of the approach that are techniques to help them stay safe and to be in control of what's happening during the session. But I really could see that it's even more widely used. It's still new. I'm eager to, and I'm hopeful that this will really appeal, especially as people who use it, who've used other trauma therapies like myself, find how profound of a difference it makes. And I think in order for that to happen, we need to get the word out. Thank you very much, Dr. Tovar,
Yay. You're welcome.
for helping with that effort. And I'm meeting with different groups in different parts of the country to tell providers. I'm trying to get on, different platforms to help spread the word, just to get people interested in it and trained in it. And then, of course, we need more research. I'm really planning to put out some case studies in the next few months so that that can also add to what people know about this really innovative approach to trauma work.
Oh, I love this. Now, you did mention safety, so now I have to ask.
Yeah.
I didn't realize I should ask about that. I should ask about that. Give me a picture of how you do ensure a client's safety in a session.
So we know that people who have trauma um, tend to be disconnected. If someone's had a trauma that involves their body, especially sexual trauma, but it could be any kind of trauma, a motor vehicle accident, a natural disaster, people tend to cut off from their body. They don't understand, they're not connected, they don't really feel a lot in their body, um, and they don't trust it. They don't trust other people, they don't trust themselves. And so safety is a true, hypervigilance is a symptom of PTSD. That's I'm looking around, I'm checking people out. I'm looking at that backpack over there. When I sit in a restaurant, I'm sitting with the exit in my view. That's because part of trauma makes us hypersensitive to safety concerns.
Mhm.
And I think that's why we have several techniques during a MEMI session to help people feel safe.
Mhm.
So, one way we do that is through, and people who are familiar with EMDR know about um, this anchoring that we use, but we do it a little bit differently. And so that's one technique. I'm happy to take you through it if you like, but let me just mention the other techniques. The other is something called therapeutic dissociation. So, when someone is triggered from a traumatic situation and they're triggered, the past is brought up to the present like that. It's like it hits you in the face. They're right back there. They're just taken back there without any volition involved. And often people also dissociate, so they space out. That something comes into their mind or something reminds them of something, they just kind of go somewhere else, which is a safety mechanism, involuntary and not very people don't like it. Who would like to not be present with
Mhm.
yourself? But that's very common with trauma. And so therapeutic dissociation is a way to help someone dissociate, separate, not be associated with the trauma. And we do that, I told you before, about we're casting that event up on the wall. So that's a spatial separation that we're helping them understand, and they have control over that. I
Mhm.
often will tell people, if you need to push that 10 feet away, if you need to push that a mile away, you can do that in order to stay engaged with that memory while we're doing the eye movements. And it also reminds them, I'll often say when I anchor, so you're, whatever the anchor word is, you're strong. And this is us here now. That's back then. Right? So we're
Mhm.
helping them in a therapeutic way, and a way in which they have control over this event in their mind by putting it way back there. So that's
Beautiful.
their yeah, therapeutic dissociation. And then we have physical grounding. So if for some reason someone starts to feel emotional or, just be upset during a session, we always tell them, you can take a break at any time. This is
Mhm.
part of giving them control. It doesn't interfere one bit. And so I might do a little bit of physical grounding with them just to help them come back to the present and to be able to continue with the session.
Ah, I can only imagine you are just an amazing therapist. Just I think your clients are so fortunate to be
Oh,
able to
thank
work
you.
with you. You have such an amazing presence, and the way that you're helping people is so innovative and just fascinating. I'm definitely looking more into MEMI 'cause I can see how that could easily be integrated into my practices. I have a
Yeah,
lot of trauma clients,
yeah,
clients with trauma.
yes.
Um, but for people who want to know more about MEMI, more want to connect with you, maybe want to work with you or explore your trainings, please give us the 411.
Well, let me tell you a little story about the Dr. H assignation. Um, Many times when I was working with people, and my view, I really view this as witnessing for them, witnessing being with them in a very present way as they're recounting these events. When we get towards the end of their treatment, they say, God, I wish I could just put Dr. H in my pocket. And so that's my email account, Dr. H in your pocket.
That's
And
why I was
yes,
wondering. Yes.
yes, it's just uncanny how many people would say that just out of the blue. God, I wish I could put you in my pocket. And so I thought, okay, we'll do Dr. H in your pocket. And so it's Dr. H in your pocket at gmail.com. I also have a presence on the Multichannel Eye Movement Integration.com website. And so there's information about me on that. And you can click on that and it will come to me. I'm still working on a website and a YouTube channel, but that's to come as well under the same name, Dr. H in your pocket.
Oh, Dr. H, you are just, I want to put you in my bucket now. There,
Yeah,
I've done it. I will
good.
pull you out whenever I need to just smile and feel better about my life. Thank you so much for agreeing to be on this podcast. I think we've learned so much, and I do think that this is such an important and innovative treatment. And I know I'm going to be looking into this more, and I really hope everyone else out there takes a look at this training because it really is something else. If we can resolve our trauma in one session, can you
Yeah,
imagine
yeah.
what else we could do with our lives? Oh my goodness. So thank you so much for joining me, Dr. H.
It's been a pleasure.
Yes,
Thank
and thank
you.
you everyone for tuning into the New Insight podcast. I, of course, am looking forward to the next exciting interview, and I hope you join me next time. Thanks for tuning into the ANEW Insight Podcast. Please remember, the contents shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming, on YouTube at my.anew.insight and at anew-insight.com under the ANEW Insight Podcast tab. And follow us on our socials at my.anew.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.